For all Americans, we must confront the rising cost of care, strengthen the doctor-patient relationship, and help people afford the insurance coverage they need. We will make wider use of electronic records and other health information technology to help control costs and reduce dangerous medical errors.
So said President Bush in his State of the Union address, receiving bipartisan applause. But what exactly is an electronic medical record, and how can it benefit the average American?
Electronic medical record, we all think of it as basically replacing paper. But really what it is a process. It's the path of taking things that we have as paper or individual data files like an X-ray film or a film jacket and making that electronic.
So that doctors have a patient's complete medical history from past surgeries and blood tests, allergies to ultrasound exams right at his or her fingertips. While some of our nation's hospitals and medical centers have begun transitioning to electronic records, most have not.
From a safety issue, we all focus on the most obvious benefit, which is it's better to take care of patients when you have data. If I have to take care of somebody and I don't know what their past medical history is, there's a name for that. It's called guessing. Electronic medical records really are about taking much of the guesswork out of healthcare.
At the same time, reducing reliance on faxes and phone calls and often timely and costly duplications of exams and procedures. Doctors say we need only look to New Orleans and Hurricane Katrina to see why paper records can prove deadly. Floodwaters rendered many patients' medical histories unavailable and unreadable. With secure electronic records, patients would always have a backup. Well, many involved in healthcare agree that electronic health records can help to improve patient care and ultimately reduce the cost of that care. Initial costs remain an obstacle, and the question of who will and who should pay for the transition to electronic records is among the issues still being debated.